Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare.
We are happy to welcome Dr. Yan Trokel, founder and medical director of Ylift Spa and creator of the revolutionary 30-minute Ylift procedure. Dr. Trokel joined us at AFRM Houston in March of 2019. Thank you for taking the time to visit with us today.
Thank you so much for inviting me to be here.
So let's start by talking a little bit about your medical career. Take us back to when you first decided to go into medicine.
So my overall training and education was very long. You know, when I was first interested in becoming a doctor, we all have these different dreams and visions of what we want to do in our life. And one day I was working in the ER and I came across, it was during college when I came across these surgeons that were treating this big trauma case. And I looked at them and they had this extensive training. And they were able to put back together a face in a way that I had never seen before. And it was when I realized that if you really wanted to understand the face, you had to have both the dental and the medical. Because if you think about it, it makes up the entire face, all the hard tissues and soft tissues. So that's when I started my journey. So I enrolled in dental school, then I went to medical school, then I did general surgery, then maxillofacial surgery, and then I finished it off with a fellowship in the aesthetic cosmetic surgery. And this was all offered through UT Southwestern in Dallas.
And the reason we're visiting with you today is that you have developed a revolutionary technique for facial rejuvenation. Can you tell us about that?
I've never taken anything at face value. So even during my training, I questioned a lot. And it was during my aesthetic fellowship, when we were doing a lot of cosmetic procedures, I would look at young people and I would say to myself, why is a 40-year-old person getting a facelift? And then I would look at an older person. And then I would look at their results and I would say, they look better, they look tight, but they don't look quite right. They look a little pulled, a little wind tunnel, they don't look like themselves. There's something that's gotta be missing. And I went back to all my training that I had and I started to understand what really happens with aging. And that's when I started to understand it and I started to develop the Ylift technique. So we know that aging is a process of shrinkage. So the face is no different. Now what holds us up? It's our structural support, which is our bone. And that all changes. And this is what the premise of Ylift is based on and how these changes occur. When you see like deepening of the folds or the hollows in the eyes or even eye bags or when we get the jowls or the neck, these are signs and symptoms of aging. But what is the underlying cause? And that is the shrinkage. But it shrinks in a very particular way. Now, understanding anatomy is very important, but there's more to it. You have to understand the laws of physics. We follow the same principles of physics with aging. It is this combination of understanding anatomy and the changes that occur with that shrinkage and where it occurs. This is what Ylift addresses in a very or minimally invasive way. But the results are dramatic yet natural.
And so where does the name come from?
So everyone thinks that the Ylift is based on my name because my name is Yan, but it's not true. See, the primary facial pillars of the face is the top jaw, the maxilla, and the mandible. And if you look from a frontal view, the perfect shape of each of those pillars is like the shape Y. Let me explain. You see, if you look at the top jaw, now the top jaw is the maxilla, right? And it's this part right here, all of this. And when you look at somebody from a frontal view, it comes up and it goes out to the widest part right here, the malar prominences, that's your first Y. When you look at the mandible, again, it comes up from the neck, and again, the widest is right at the angles. So each of those pillars are Ys. And that's where the name comes from. And that's what we want to achieve back. And as we age, we lose those Ys and we become a different shape.
So what's actually being done in this procedure? Are you injecting fillers?
So if you think about it, if you lose something, what should you do? You should put it back. That's why people who just get things pulled don't look right. Because again, you're not treating by just pulling the underlying cause. So if we're losing our bone, then we have to replace that. And that's what Ylift does. The Ylift is based on surgical sound principles that I learned as a maxillofacial surgeon, but it's done in a minimally invasive way. So through small little tiny ports, 22 gauge needle-sized holes, we're able to re-expand where that bone was lost, and we use dermal fillers, just what everybody uses, in a way to restore that lost bone. But it does it in such a natural way. And even when you look at the patients, they look sculpted, not bloated. They will never look puffy or done because you're putting back at the level of the bone what was lost. What are the results? The entire face is lifted. You'll see the hollows or the bags under the eyes disappear. The cheekbones become prominent again. The jawline is sharp and crisp. The neck lifted. All in just 30 minutes. And everyone will look at them and say, wow, you look really good, but they'll never be able to put their finger on it. And the reason for that, even though the results are dramatic, they're natural.
And I would imagine that it has to be very gratifying for you personally when your patients are so happy with the results.
You know, I became a doctor to help my patients. And when patients look in the mirror and they see their transformation, or when they come back and they tell me like what their friends are saying about them, the joy that you bring to them, isn't this why we got into medicine? To help them? Aesthetics is a part of patients' overall concerns for their well-being. Patients want to feel good and look great. It's both. With all my consultations in my office, I speak to my patients about wellness and anti-aging. At the same time, when I discuss their aesthetic needs. One goes with the other. They cannot be separated out. Our lifestyle, our overall health affects what we look like. You know, when people say, oh, it's genetics, genetics makes up a part of it. Our own nurture, stress levels, our day-to-day, what we eat, how we exercise, everything compounds everything. So what we look like is also an example of what's going on inside. So if you can optimize both, then we've really hit a home run. And our patients will get results that they've never been able to get if we just only looked at one thing.
And this is something that any doctor can do and incorporate into their practice, right?
I've created the Ylift so it can be reproducible. I've trained already over 200 physicians. And not everybody was a plastic surgeon, facial plastics, maxillofacial surgeon. A lot of them had no aesthetic training. And they're able to, as long as they follow the step-by-step protocol, which you can learn in 2 days, you will continue to deliver reproducible, amazing results to your patients. Think about how incredible this is. You treat your patients on the inside, and now they come in and they say, Doc, I feel amazing, but I just don't look what I feel inside. And you can, within your office, and there's no special equipment, in the chair that you have, in just 30 minutes, you can transform them so that their inside and their outside match. I developed the Ylift 12 years ago. And within the 12 years, you know, there's been a lot of buzz about Ylift. It's been featured on Dr. Oz. He called it the 30-minute miracle facelift. The doctors, he said, you know, Travis Scott, Dr. Travis Scott, he said, this shouldn't be called the Ylift. This should be called the Wow Lift. Because what he saw me do in 30 minutes, and under 30 minutes, he couldn't believe. New York Times wrote 2 pages on it. Forbes listed it. It's been featured in a lot of magazines and media outlets because it's the real thing. It really is a game changer when it comes to the world of aesthetics. And this is what my journey is today. I want to share my Ylift so that the doctors and their patients can reap the benefits and the joys that I've been doing with Ylift.
Well, thank you for joining us today, Dr. Trokel. It's been a pleasure.
Thank you so much.